Hello everyone, I'm Dr. Chandan here. Today I'm going to share you the most important topics in forensic which you must know. Guys, I went the last 11 papers of FMGE and I have selected the topics which are repeated in multiple exams and which are expected to be asked in upcoming exam. So make sure you don't miss any of these topics. So let's know what are those topics. First is dying declaration. Dying declaration is very important. Know about it very well. Next, we have leading question. The question will be asked like leading questions are permitted in which condition? Like is chief examination, re-examination, dying declaration. You should know about leading question very well. Next, we have magistrate inquest is done in. What are the conditions where magistrate will do inquest? And know about police inquest also. Next, we have color of liver motifs. Color of liver motifs is also one of the extremely important topics where in which condition, which color of lividity you can able to see. For example, like carbon monoxide in burns, you'll get to see cherry red color of lividity, and in case of cyanide, we'll get to see brick red, bright red, opium black, like this. You have to know the color of liver motifs, which is important. Now, next is cadaveric spasm. Again important, you need to know the features like image and whether it's a primary relaxation is present or not, whether it's antemortem or postmortem in nature. You need to know these points, whether it's voluntary or involuntary muscle involved. Know about cadaveric spasm. Next is Burking, again extremely important. Then MTP, I can't stress, again medical termination of pregnancy is important. Refilled gun injuries. Refilled gun injuries may close and near shot is important, so know that very well. Now fingerprinting study, know the types of all the types of fingerprinting, and again fingerprinting study is important. Snakes. In snakes, you need to identify the snakes by looking at the photography. Number one. Number two, you need to know the different clinical features seen in different snake bites. Next, you need to know the treatment, how you will manage the case of snake bite. This is very important. Snakes. Next, we have arsenic poisoning and lead poisoning. Both are very important. Know about arsenic poisoning and lead poisoning both very well. And next, we have the test to detect semen as well as blood. Test for the semen and blood identification. Again important. We have like Barboratus, Tegmentus, Takayama test. We will be having, just make sure you revise that. Guys, these are all very simple and crystal points we need to know about these particular topics. So it's very easy. You can easily answer any question if they ask any question from these topics. Next, about the clinical features or the symptoms you will get to see in Datura seed as well as Nux vomica seed. Clinical feature you should know very well. Next, we have chop wound, laceration, incision and abrasion. Know about this clinical feature, like how to identify what are the clinical feature we'll get to see. What are the margins, by looking at the margins, edges, tissue bridges, all by looking at, you can able to differentiate. In chop wounds is caused by heavy weapon. You'll get when you are solving the questions, you will get to know this. Next, we have liver motifs and marbling is also very important. Next, we have post-mortem eye changes, like we have a Kevorkian sign and Techinus sclerotica, which is also important. Make sure you know about this also. Next, we have like superfecundation, superfetation and suppositious child. It's also very important. You should definitely know about this. What are these terms? Now, next we have complete and partial hanging, and know about what is garroting, how garroting will be, and Bansidola and mugging and Spanish wind loss. Know the image also on this particular term. Next, we have like know about this definition also. What is medical maloccurrence, which is also act of God, and what is contributory negligency, what is vicarious liability, and what is recepsa locitaris or novus acus intervenus. You should know about this also. Next, we have about like they will give the chest X-ray. Not chest X-ray, maybe like hand X-ray or scale X-ray, and they will ask you to identify the age group. So how you will able to identify the age group? By looking at the ossification of the maybe wrist, elbow or the ischial joint. You have to identify the age group of this particular person. Next, we have battle baby syndrome and body packer or body stuffer syndrome. Know about this also very well. And paraphilias at last is also very important. Know about all the definitions of maybe what sadism, masochism we have, and fetishism, transvestism, and what is scotophilia, bondage. Know about this also, which is very important. So this all about forensic. Definitely by solving the questions of these topics, you can able to boost your score. These are very simple topics. You can easily answer the question from this topic. So make sure you learned and remember well. Thank you.